So let's park here for just one moment. This is our level set, the usual epidemiology. What's our current status? We know that there's an increasing proportion of men that are in fair or poor health in the United States. Heart disease, there's no way getting around it. It is still the leading cause of death, and it's going to continue to be the leading cause of death. If anything, as we start to see, greater upstream associated risk factors that lead to downstream poor health outcomes, we may start to see an even greater exacerbation of the resulting deaths due to heart disease, which now we see that at least a quarter of deaths in the US for men are due to heart disease, and the usual players of malignancy. And I think with regards to lapses in screening, lapses in personal ownership of health, and even the willingness to step forward, leading to decreased surveillance and downstream poor outcomes. We have increasing obesity rates. There was a question that came in about gender, so let me answer that for a moment, because I think that's a really important piece. Speaking as a master's in public health, I put on a little bit of the nerdy public health hat from time to time. The demographic data and the capture of that data is so poor and incomplete. Sometimes we can't speak to gender versus sex. So I apologize, in my here with regards to inequities persisting between genders, I should have put sex there, right? I can't speak to identify gender identification because it's not asked for most data capture. So that's something that speaks to a shortfall of public health and healthcare, and it accounts for an underserved and inequities and downstream health disparities. So I just wanted to take a moment to recognize that, and then just recognize that even within male sex, we have race, ethnicity, socioeconomic, persons with disabilities, education level, MSM status, whatever it can be. It's not just a one size fits all for men, right? There's a lot of different risk factors and a lot of things that put us at variable risk for different outcomes.